completely bald. They will never lose their hair completely. And these are the different patterns. The grade 1, you have like an area here where you start seeing thinning in the frontal, and then that area becomes a little bit thinner and a lot thinner. This is grade 1, 2, and 3. The other way we evaluate thinning in female is what we call the Christmas tree pattern. And as you can see, the density of the hair, when you part in the middle, it starts getting more diffuse, like you see here, to the point where it's very diffuse, almost like a Christmas tree. We call that the Christmas tree pattern. And these are patients that are having progressive hair loss. This is the female pattern hair loss. Sometimes, and even though 80% of women will have a little bit of a temporal recession, like men in the temporal area, it's not very common to have the male pattern hair loss with a lot of temporal recession here and the loss of the frontal area. Women normally do not lose this frontal area here. So now, that's women. Now you know a lot about, the different causes of hair loss, what we need to do when we evaluate women. We need to make sure their diet is okay, their nutrition status, their blood test, their family history. It's a lot of things. In men, it's a little bit different. It's a lot straightforward. This is like the 3 stages in men, the same way. Their pants keep going up as their age goes up. The 20-year-old, the 40-year-old, and then the 80-year-old. So, okay, how about male? 50% of men, and that's actually over 50% of men, will have some type of hair loss, the type that we call androgenetic alopecia by the age of 50. And I participated in this community-based trial a couple years ago, which was really, really striking, because what we wanted to do is we wanted to see the incidence of hair loss in younger kids, like in adolescents, because we get a lot of teenagers that come in with hair loss, and then you're concerned. You say, is this the genetic type, and how are we going to counsel them, and what are we going to do about it? Or is it something else, like we've reviewed at the beginning? And to our surprise, 16% of men age 18 to 28 to 29 had androgenetic alopecia. So already 20% of men by the age of 20 have some kind of androgenetic alopecia. And it goes up to 50% by the age of 40 and over 50% by the age of 50. So it's a very, very significant problem. And it can start at a very early age. And the issue with male, it's a little bit different. It's better understood than in women, because in male, the testosterone and the hydrotestosterone, which are the male hormones, have a lot to do with their hair. Because what's been discovered is that this dihydrotestosterone, which is a very, very, very potent male hormone, is the one that's responsible for making these thick terminal hairs over time, making them progressively thinner, shorter, and less pigmented. So the hair gets thinner in diameter, a lot shorter because it won't grow, and it will also be less pigmented. And the problem with men is by the time their hair loss becomes significant, they've already lost 50% of their hair. So that's why the earlier you start the treatment, the better. And this is just a really nice picture to show you how the hairs grow shorter over periods of